Hello everyone, welcome to my channel RX Diary Girl. In today's discussion, we'll be talking about hyperlipidemia or high cholesterol. Have you been diagnosed with high cholesterol and your doctor has given you a medication to lower it? And you're wondering whether I should take it, what happens if I don't take it? So let's discuss about high cholesterol and what happens if you don't take your high cholesterol medication that your doctor has prescribed. So, you have been diagnosed with high cholesterol and you're not sure what to do. In discussion with your doctor, you can first try lifestyle changes for 3 to 6 months. During this time, you will start exercising, eating healthy, try and lose some weight. 3 to 6 months is a good trial period with lifestyle changes to see if your cholesterol is coming down. So you're feeling fine, you exercise regularly, you're not overweight, but when you go for your blood work, your cholesterol levels has not come down much. It's still high. So you feel frustrated. Sometimes high cholesterol runs in the family. And for such people, it's hard for the body to remove the bad cholesterol from the blood. As a result, cholesterol builds up in your blood. High cholesterol is very sneaky and silent. You may not know that you have high cholesterol, and a simple blood test is the only way to find out if you have high cholesterol or not. That's why people as young as mid 30s, around 35 years old, should start getting tested every 5 years at least to make sure that they don't have high cholesterol. Now you know that you have high cholesterol. You've tried your 3 to 6 months of lifestyle changes. It's still not coming down. Your doctor has given you a prescription for a cholesterol lowering medication, and you're still not sure if you should take this medication or not. So let's see what happens if you are not taking the cholesterol medication that the doctor prescribed for you. High cholesterol leads to a condition called atherosclerosis. That means there's buildup of fats, cholesterol, and other substances inside your blood vessels, and this buildup is called plaque. The plaque can cause the arteries to become narrow and it affects your blood flow. When the blood vessels that supplies the heart muscles gets blocked and your heart doesn't get enough blood because of the blockage, that's when you have a heart attack. This blockage happens from many years of cholesterol building up in your blood vessels and forming plaque. And if you're lucky enough, the heart attack is mild and you'll survive. If you're unlucky, you can die with the first heart attack that you have. If you had taken the medication that the doctor gave you for cholesterol lowering, this heart attack would have been pushed to another 10 to 15 years and your lifespan would be longer. Instead, if you chose not to take the medication, then first you may die from the heart attack. Second, if you survive the heart attack, you'll be spending a lot of money for angioplasty, stenting, and everything else that comes with a heart attack. Plus, you would be ending up with 5 different medications after a heart attack. So instead of one medication, now you spent a lot of money, plus you have 5 regular medications that you need to take. Another complication of high cholesterol is a stroke. One of the reasons a stroke can happen is when a blood clot forms and blocks an artery that supplies the brain. This usually happens for people with high cholesterol. The blood clot happens because of the buildup called plaque, because of the buildup of cholesterol and other fatty substances that blocks the artery. A piece of it can break off, leading to a blood clot. Then it can go through the blood vessels and form a clot in the blood vessel that's supplying the brain. A stroke can happen when atherosclerosis or buildup of cholesterol affects your carotid arteries. These are the main arteries or blood vessels that supply your brain. So when these arteries get blocked, the blood flow to your brain is affected, and you get what is called a transient ischemic attack. It's called TIA, or a mini stroke as well. Depending on how severe the stroke is, you may end up with one sided paralysis, you may end up with a lot of deficits. You cannot walk properly, talk properly, remember. So it affects your lifestyle. Plus, you will be ending up with a whole bunch of other medications to take after a stroke to prevent it from happening again. So, if you had started the cholesterol medication in the first place, then this would have been happening maybe 10, 15, or 20 years later. Another complication of high cholesterol is peripheral arterial disease. So, this is a condition where the circulation to your extremities, like your arms and legs, get reduced, and you may have leg pain when walking. This is called claudication. You cannot walk for more than 5 minutes. Your leg starts feeling hurt, and you have to take rest before walking again. So this is because of lack of blood flow to your legs or arms, and this happens because of blockage again. So make sure you go for blood work, know your numbers. If your bad cholesterol or LDL cholesterol is under 100, you're good. If it is between 100 to 159, you're at risk and you need to take action. And if it's more than 160, it means it's dangerous and you needed to take action yesterday. So make sure you go for your annual checkups, blood work, and whatever decision you make an informed decision. What happens if you don't take your medication? What happens if I take my medication? So risk versus benefit. Make sure you make your choices wisely and have a healthy life. If you found the information in this video useful, please subscribe and